And welcome to part 2 of the asthmatic videos, and my name is Marsh and I am an asthmatic, as I explained in the last video. In the last video we were looking at some of the symptoms and the causes and what we can do by seeing the doctor, but I'd like to go on to the trigger points of asthma. What is it that seems to kick in and attack or bring it on? But before I do, I've got a suggestion to you. There is a drug called thalidomide, yeah, and by having caffeine, it produces some of the same effects as having the drug which they treat a lot of asthmatics with. So, yeah, having a coffee can help a lot of asthmatics. Not cold water, not warm water, not the drinks. Yeah? But please try, if you wish, having a cup of coffee, because apparently the caffeine within there just behaves like it is of getting treatment of that particular drug. If not coffee, have a cup of tea, especially in England. And hopefully that will help alleviate some of the issues and help you to breathe. Now, trigger points, we do have various types of trigger points. Some what I call under occupational asthma, which can be not the occupation necessarily of what you're doing, but what is going on in the vicinity around you or as you go through a vicinity. Certain chemical fumes, farming fumes, gases, dust, all these things can kick off your asthma. And then there's allergy induced trigger points for the asthma, such as things that are airborne, again, pollen, spores, dust appears there again, along with pet particles. Yes, some of the allergies can be our beloved cats and dogs, or birds even. Now, some of the other trigger points can be related to respiratory infections, such as a common cold or flu. Might be a point now to mention to most people, how do you feel about having a flu injection each year? Yeah? So we've got certain trigger points, and then we go on to what we call atopic dermatitis. Another common one, hay fever. What I'm completely guilty of, and most of my life, is being overweight. What I will say is I've been on a number of diets. Sometimes I've lost 7 stone. My biggest achievement was losing 13 stones once. What's that, about 172 pounds or something like that. But I will say, on losing weight, I did have a massive benefit in that my asthma was greatly alleviated. However, on one occasion, I lost, in fact, it was the time I lost 13 stone something or other. 13 stone, might have been half, 13 and a half. And I put myself in hospital. So diets are perhaps the wrong terminologies. It can be great to losing a quick lump of weight, but it should be a change of life. That is something seriously I'm looking at. I need to change my life, and it might be that I have to have a mass loss of weight, but I won't treat it as a diet. I do have something running in the background currently, and because of the situation, the coronavirus, an operation has been cancelled. But that can't help. It's a case of priorities, and can't argue with that. Having said that, it may be just something I have to have as a contingency plan, and if you wish, sort myself out. Being a smoker, I currently smoke, not many, And I didn't start until after the age of 40. I think I must have been 42. Somebody bought me some cigars for Christmas. One of the worst things that could have ever happened. And I used to love a cigar, and then I loved an expensive cigar. And then I started buying cigarettes. But being a smoker is absolutely no good. If you can quit them, fine. And again, that's another thing I've got cooking with myself on giving up. Exposure to second-hand smoke, you know, if you wish. There are some public places where we can't ask people to put out a fag, but there are places where people do smoke, and it's your air as much as theirs. Ask them to put it out. If you don't want the conflict, then simply move. Why should you be inhaling their smoke? Exhaust fumes is a big one. Asthma really grew, I think, in the 70s and the 80s, and in the 90s it kind of plateaued out. But the exhaust fumes and pollution, and not just from exhaust fumes, but other types of pollution within the air, I think led to it did lead to the explosion of asthma sufferers. And then you've got chemicals and even farming. You know, sometimes you're walking past somewhere and you think, like, what the hell is that stuff? You know, not just farming, more frequent ones perhaps for the ladies. Not trying to be sexist, but hairdressers. You know, how many times, and even the barbers, how many times guys are in there and it's like, what the bloody hell is that? Yeah? And you can feel it on your chest. You think, how can people go around breathing that all day? But, you know, again, it's not as much as an effect to anybody else except an asthma sufferer. In manufacturing, yeah? How many chemicals are used in manufacturing, or odours do you get, or things in the air which do, if you wish, play up on your chest. Conditions are looked at into as well, whereas what we eat, what we don't eat, and through the research I've done and people I've spoken to, there's no set, it's the same as curing asthma, there is no set thing in, or what foods into what you can eat is proven that it helps you. Although lots of people do say that certain things do help them. What is suggested and recommended is you try and get lots of vitamin D down you. And probably after that, there's the mention of eggs and milk. So eggs, milk, and vitamin D seem to be in the high scoring, but trying to get people to actually, you know, say this works and this doesn't work, with an official stamp on it, is a wee bit different. However, they do suggest as well that under the age of 15, you try not to have as much eggs and milk, and it does have an effect on the younger end, and a lot of them do struggle. Again, if it is that it's been identified in the youngsters, check with the doctor. Maybe they do a test on them, an allergy test or something like that, to see or identify how they would react. It may be they're at a time, or it may be a type of asthma where it's not going to be an issue. But if anything, them are the high scoring points to me before you start looking at healthy foods anywhere. Yeah. And again, like I say, from the age of 15ish is indicative of when things change, and then you start suggesting to adults your vitamin D and your eggs and your milk. Play it safe. Do use the doctors, do use the nurses. They are there for a reason, yeah? You will find that you'll probably get invited to a review every year, if not every 2 years at max. Indicators themselves, like I said, you will know because of the frequency of the sprays that you use or the effectiveness of them, yeah? And these peak breathing monitors you can buy, they can come in handy so you can measure yourself. There are other things that we can look at, such as, you know, people do, and I mentioned in the last video, and I hope you did take it on board, and that's to have a think of things, whether or not it's old wives' tales. Please put them on the comments part of the video, yeah? Do list them, no matter how silly they may seem or not. You know, I mentioned about salt air on the beaches at Blackpool Beach, you know. My dad making me inhale as much of that fresh air, fresh sea air as he could. And I have seen one or two things, as I've been researching, with a mention of salt. Not necessarily like, you know, eating it, but using certain breathing apparatus. You know, maybe you have a particular type of ventilator or a humidifier, yeah? People in the old days used to put down, if they had electric fire, they had a bowl of water there to help put the humidity back in you and release some more oxygen. Whatever it is that you've tried and has worked, no matter how silly it seems, list it. People may use certain crystals, stones, yeah. Not everybody's convinced by that. I do question certain things. Sometimes it helps the mental powers, yeah, to overcome it. And whether or not it's you physically not being proven, but it helps, why not? Anything that does help is fine by me. Certain breathing exercises or yoga, yeah. Try and do certain deep breathing exercises, yeah, and tuning your mind and counting the number of times that you inhale and exhale, you know, per minute. Have a read up and try whatever is best for yourself. So anyway, please list anything. I am happy if it is that either you acknowledge things the same as me, or it is that you've picked up one thing. You know, the caffeine bomb was one for me, having a coffee. I do love coffee as much as I do like my herbal drinks. Before I go as well, I must mention, we're going on to herbal drinks, herbs. I will be doing another video where I relate to things like garlic and honey, and indeed there's one powerful remedy I want to have a look at, and that's the infusion of raw honey along with soaking garlic in them for several days, and then if you wish, having a spoonful a day. There are a number of people who do say that garlic helps them with the breathing. It certainly helps to clean the blood and helps along with blood pressure. Anyway, from a lot down Berlin, I thank you, and again, keep up the fight, and please like and subscribe if it is that you would like to see another video. Thank you.